Hello, this is Professor Lou, and this is our lecture about diet and health. So let's get started. So before we begin, I want to talk about just diets in general. So everyone has a diet that they typically eat. Every region, every culture, every family kind of has a diet that they eat. And often the diet that people eat is related to what's available, what they're used to, what they ate as children, what they are exposed to as far as what others are eating around them. There are many, many contributors to what the diet is. And we're going to very quickly move into therapeutic diets for specific management of conditions. So I want to just mention before that diet is a term that means what people eat. So the diet of a region or an area is just as important as studying a therapeutic diet. It's just that the therapeutic diets are emphasized in nutrition class because they do help manage disease and help prevent disease in some cases. And so we talk about that a lot. But I want you to think about the diet that you grew up with. If you live in a different place than you grew up, the diet where you live now, the diet of any place you've spent any significant amount of time, and just think about what were the protein sources, what were the lipid sources, what were the carbohydrate sources in those places, and how that might have developed over time and how it might be changing. And then we'll get into the therapeutic diets as we continue. Now, the first one we're going to discuss is the DASH diet. And that's a really good one to start with because the DASH diet is intended to help people manage hypertension, which is high blood pressure. And hypertension is very common. So we are all getting way too much sodium in the US diet. And so reducing that sodium is a big challenge. And it can help to prevent problems with hypertension. It can decrease people's blood pressure. So we definitely want to encourage that. So DASH tips for lower sodium include using spices instead of salt to add flavor, reading sodium content on processed or canned food labels, and choosing lower sodium options. And then removing the sodium from canned foods such as beans by rinsing the product before consumption. So you can just buy lower salt items, but if that's not possible, you can also just dump the beans into a strainer, colander, and rinse them, and that will get quite a bit of the salt off. And also avoiding salt when cooking. When it's not necessary, there's no reason to put salt into things and just add it for no purpose. And sometimes people do that. Sometimes people are adding it for flavor, but they're just adding way too much. So the pros of the DASH diet are as recommended by the National Heart, Lung, and Blood Institute and the American Heart Association and by many physicians. It helps to lower blood pressure and cholesterol. It reduces the risk of heart disease and stroke, which are leading killers. It reduces the risk of certain cancers, and it reduces the diabetes risk. So these are all really good pros. Cons are that there are very few negative sides to the DASH diet, but it could cause hyponatremia, especially if taken to an extreme, but that would be pretty rare. Okay, moving on to the gluten-free diet. So the gluten-free diet helps people whose bodies cannot tolerate gluten, a protein found in wheat, barley, and rye. One of the most important ways to treat this condition is to avoid the problematic gluten and the foods that contain gluten, but that's not easy because they're throughout the food supply, especially in the US. So although following a gluten-free diet is challenging, it is prescribed for people who have gluten intolerance and celiac disease. Now, celiac disease is an autoimmune disease with a genetic link, and people who have celiac disease cannot consume gluten products without damaging their intestinal lining. So eating a gluten-free diet is really essential for them, and they have to replace the foods that have gluten like bread, cereal, and pasta with other foods such as fruits, vegetables, and any other food without gluten. But it's important to note that the gluten-free diet became kind of a trend or a fad, and that those without gluten intolerance and celiac disease, which are relatively rare conditions affecting only about 1% of the population, really don't need to eat a gluten-free diet. And people really shouldn't be eating a gluten-free diet unless it's a recommendation for them. It can really limit the foods that they're eating sometimes. So the pros of the gluten-free diet are it reduces symptoms of gluten intolerance, such as chronic diarrhea, cramping, constipation, and bloating. It promotes healing of the small intestine for people with celiac disease, preventing malnutrition, and it may be beneficial for other people with autoimmune disease, such as Parkinson's disease, rheumatoid arthritis, multiple sclerosis, but certainly there's not as much evidence of that as there is for its helpfulness in celiac disease. The cons are people on this diet can be at risk for folate, iron, thiamine, riboflavin, niacin, and vitamin B6 deficiencies. And why do you think that is? Just think for a moment. Why would they be at risk for some of these? They are at risk for some of these because we actually have added them to our grain products as a fortification, right? We've added it back to make sure that people don't get things like pellagra, right? So that's the niacin deficiency disease. So when we take these out of the diet that people are eating, they may be at risk for those deficiencies. Special gluten-free products can be hard to find or they can be more expensive. And being on a gluten-free diet requires constant vigilance and careful food label reading because gluten is found in so many products. Okay, let's talk about the low-carb diet. The low-carb diet, and that includes the Atkins diet, the South Beach diet, and other diets, focusing on limiting carbohydrates such as grains, fruit, starchy vegetables, and this is to promote weight loss generally, are low-carb diets. Other ones that you may have heard of are paleo and keto, or Paleolithic and ketogenic are the longer names for those. The paleo diet mimics foods that humans consumed during the Stone Age, and this diet promotes higher amounts of grass-fed only animal protein, healthy fats, and non-starchy vegetables like okra, bok choy, carrots, and the keto diet highlights high protein intake and healthy fats. However, there is more flexibility with the source of protein, the animal proteins, and it does not have to be limited to like the grass-fed animals. And the paleo diet does not allow for dairy foods, while the keto diet allows dairy foods without added sugar. So the theory behind the low-carb diets is that insulin prevents the breakdown of fat by allowing sugar to form in the form of blood glucose to be used for energy. And proponents of this approach believe that because they're limiting the carbohydrates, that generally lowers the insulin levels, and it would be a cause for the body to burn stored fat instead. They actually believe this method not only brings about weight loss, but reduces risk factors for a number of conditions. However, it should be noted that some studies have shown that people who followed a certain low-carb diet plan for 2 years lost an average of nearly 9 pounds, which is similar to the amount of weight loss on high-carb diets. So that may not be so true. The benefits of this kind of diet include an emphasis on whole, unprocessed foods and de-emphasis on refined carbohydrates such as white flour, white bread, and white sugar, but there are a number of downsides. So the pros are it restricts these carbs that are simple, and it may temporarily improve your blood sugar and or cholesterol levels. The cons, though, are not entirely evidence-based, okay? There's a lot of assumptions here. And it results in a higher fat and protein consumption, which could have negative effects, and it does not meet the RDA for carbohydrates to provide glucose to the brain. So if that's happening, where you're not getting enough to provide glucose for the brain of that carbohydrate for energy, then that would not be good for you at all. So that is the low-carb diet. That definitely has become popular. And that's the kind of thing I hear with some of the athletes that are saying, I don't eat any carbs. And I'm like, oh no, I hope they really do eat carbs because they need those for their energy. They need those for their brain. Next, we're going to talk about the microbiotic diet. The microbiotic diet is part of a health and wellness regimen based on Eastern philosophy. And it combines certain tenets of Zen Buddhism with vegetarian diet practices and supports a balance of optimal forces of yin and yang. Okay, and some people just kind of eat this way, but don't really get into all of the specifics of the Zen Buddhism and the yin and yang. Foods are paired based on their so-called yin and yang characteristics, though, when this diet is followed to the T. And yin foods are thought to be sweet, cold, and passive, while yang foods are considered to be salty, hot, and aggressive. Whole grains make up about 50% of the calories consumed and are believed to have the best balance of yin and yang. Raw and cooked vegetables comprise about 30% of the diet and include kale, cabbage, collards, bok choy, broccoli, and things like that on a daily basis, along with mushrooms and celery a few times a week. So bean and vegetable-based soups and broths make up 5 to 10% of the daily caloric intake. And additionally, the diet allows small amounts of fish and seafood several times a week, along with few servings of nuts and things like that. The macrobiotic diet prohibits certain foods like chocolate and tropical fruit and animal products because they are believed to fall on the far end of the yin-yang spectrum, which may make them difficult to achieve the Zen balance. So the macrobiotic diet focuses on foods that are low in saturated fats and high in fiber, which can help lower the risk of cardiovascular disease. And proponents of the diet also believe that it protects against cancer. But many nutritionists and healthcare providers express concerns about this diet when it's followed really, really strictly because it really could result in some problems. So while you get the low saturated fat, high fiber, and the emphasis on whole grains and the de-emphasis on processed foods, you may have not entirely evidence-based problems. You may have lack of certain vitamins and minerals, and supplements are often required. There can be a low caloric intake with this diet sometimes where there's just not enough food, not enough calories. Lack of energy may result in inadequate protein, essentially like a starvation. One pro is, though, it's rich in phytoestrogens, which may reduce the risk of estrogen-related cancers. All right, so that one isn't all that popular compared to some of the others, but it is out there. The Mediterranean diet is a highly encouraged diet based on the traditional Mediterranean diet, and it has elements of dietary choices from people living in Greece and southern Italy. I can remember when I was in college, there was a Greek student in my school, and she thought our diet was terrible. Just terrible. She said, "Where are the fruits? Where are the fresh vegetables?" She thought the American diet was awful, and she was right. The Mediterranean diet focuses on small portions of nutritionally sound foods, and this diet features food from plant sources, including those fruits and vegetables that my friend was mentioning, whole grains, beans, nuts, seeds, breads, potatoes, and olive oil. It also limits the consumption of processed foods and recommends eating locally grown foods rich in micronutrients and antioxidants. Other aspects of this eating plan include consuming fish, which we know that can be very healthy, and poultry at least twice a week, and eating red meat only a few times a month, so a decreased emphasis on red meat. Having up to 7 eggs per week and drinking red wine in moderation. And unlike most diets, the Mediterranean diet does not cut fat consumption across the board. Instead, it incorporates low-fat cheese and dairy products and substitutes, wait for it, olive oil, canola oil, and other healthy oils for butter and margarine. So you're getting those healthy oils back in there. More than 50% of nutrient and epidemiological research has shown that people that follow this Mediterranean diet have some of the lowest rates of chronic disease and the highest rates of longevity among the populations of the world, and this is the reason it has become more popular. And studies have also shown that the Mediterranean diet also helps to decrease excess body weight, blood pressure, blood fats, and blood sugar and insulin levels significantly. So this is why you find books on every bookstore shelf about the Mediterranean diet. You find lots of articles on the internet, very popular, and you'll hear healthcare professionals recommending it to patients. The pros, again, a reduced risk of cardiovascular disease and mortality, a lower risk of cancer, de-emphasizing processed foods. We're eating too many of those, so this will decrease them. Emphasizing whole foods and healthy fats, lowering sodium intake due to fewer processed foods, and emphasis on monosaturated fats, leading to lower cholesterol, highlighting fruits and vegetables, raising consumption of antioxidants. The cons are it does not specify daily serving amounts, so people could get their portion sizes out of control here. Potential for high fat and high calorie intake, as nuts and oils are calorie dense foods. So if people overdo the olive oil, there could be some issues with the calorie intake. Drinking 1 to 2 glasses of wine per day may not be healthy for those with certain conditions, and that is absolutely true. Right now, we are talking about in public health that alcohol consumption is too high, and that we have told people to drink in moderation, maybe to their detriment, because we're getting too much alcohol consumption, even among people who don't think they have a problem with alcohol. So that could be absolutely true with this diet, that's an issue. So, raw food diet. Now, this is one you don't see as much. You don't hear about it as much. You don't see people eating it as much. But the raw food diet is followed by those who avoid cooking as much as possible in order to take advantage of the full nutrient content of foods. The principle behind raw foodism is that plant foods in their natural state are more wholesome for the body. And the raw food diet is not a weight loss plan, but a lifestyle choice. And people who practice this raw foodism eat only uncooked, unprocessed foods, and they emphasize things like whole fruits and vegetables. Staples of the raw food diet include things like whole grains, beans, dried fruits, nuts, seeds, seaweed, sprouts, unprocessed produce. And as a result, food preparation mostly involves peeling, chopping, blending, straining, dehydrating things. And the positive aspects of this diet are that it emphasizes whole foods and it focuses on nutritionally rich foods. The cons are it's not entirely evidence-based, it's very restrictive and limits protein and healthy fat intake, and it could encourage the development of foodborne illnesses. And it's extremely difficult to follow. High in fiber, though, and in that way it may cause nutrient deficiencies because, when the fiber is in the body like that, it can take out food quickly and it can help with the elimination of food that might otherwise be absorbed. So that can be a problem there. So the raw food diet just isn't as popular as the others. All right, that's actually the wrong title. This is Vegetarianism and Veganism, okay? That's the real title for this page. It's got the wrong title up there. So most of you have probably heard of vegetarianism and veganism, and those are followed by many, many people throughout the world. There's whole regions of the world that are primarily either vegetarian or vegan. And it's been followed for thousands of years for different reasons, including spiritual practices, cultural reasons to show respect for living things, for health reasons, environmental reasons. And for many people, being a vegetarian is a logical outgrowth of thinking green. So meat-based food systems require more energy, more land, more water, more resources than a plant-based food system. And so that might suggest that the plant-based diet is more sustainable than the average meat-based diet in the U.S. So by avoiding animal flesh foods, vegetarians hope that they will be looking after their own health, looking after the planet's health, and all of that together. And they really are behind that goal. Broadly speaking, vegetarians eat beans and grains and fruits and vegetables. They don't eat red meat, poultry, seafood, and other animal flesh items. Some vegetarians, known as lacto-vegetarians, will consume dairy. Others are lacto-ovo-vegetarians, and they will have dairy and eggs. And then we have vegans, which is the most restrictive vegetarian diet, and vegans do not eat dairy, eggs, or animal products. And some even don't eat honey. Vegetarian diets have a number of benefits, and those include may reduce some chronic illnesses like cancer, heart disease, and type 2 diabetes. They may help with weight reduction and weight maintenance. The cons are that guidelines regarding fat and nutrient consumption must be followed, and higher risk for nutrient deficiency than a meat-based diet, such as protein, iron, zinc, omega-3, vitamin B12. Some of the reasons are some of the vitamins just aren't as bioavailable. Some of the minerals aren't as bioavailable from the non-meat-based diets, the foods that are in them. Consumption of a high-fiber diet also interferes with mineral and nutrient bioavailability itself. Vegetarian and vegan protein sources are lower quality, with the majority missing at least one amino acid. So that can be an issue as well. Vegetarianism is popular. You'll probably meet vegetarians in your life often, and some of you may be vegetarians. And it's increasingly popular in many ways. All right, so let's talk about calories in and calories out, okay? So people can sometimes consume way more calories than they need, and other people are consuming way fewer calories than they need, and neither of those is a good thing. We have more people consuming more than they need, and that is contributing to an obesity epidemic. There is a lot of information out there about obesity and a lot of public health information that tries to reduce obesity. There's also much information about how we should accept our bodies and try to work with our body's size and shape. But there really are health risks to obesity, and so we always want to make sure that the public is educated about how to reduce their personal risk, with emphasis on health and emphasis on making the diet the optimal that it can be to help them feel good and have a good quality of life, live a long life. And that is more than appearance, the goal, because different people can prefer different appearances anyway. But it should be, based on a person's needs for health and needs for longevity and needs for energy and being well. So there are some biomarkers that I'd like to mention that are not related to body weight at all. And those biomarkers are blood pressure, blood glucose, total cholesterol, high density lipoproteins, low density lipoproteins, triglycerides, regular movement activity and exercise, stress and inflammation, hormone balance, mental health status, sleep, quality of life, connection to the community, spiritual health, intellectual health, and occupational health. And it's just important to note that, our body weight and whether or not it's in the obese, overweight, normal, or underweight range is only one aspect to look at when we're trying to measure how healthy someone is. These are some examples of non-body weight measures, and they should be considered and looked at as important risk factors for chronic diseases. All right, now we're going to talk about some diseases that plague people that have to do with special diets or the diets in general. Some of them are caused by certain diets. Some of them are treated by certain diets. Some of them are both. And a few of these we've mentioned before in the class, and others will be totally new. So the first we're going to talk about is gastroesophageal reflux disease, or more commonly called GERD, G-E-R-D. So GERD is a persistent form of acid reflux that occurs more than 2 times per week. That's its official frequency to be diagnosed with GERD. And acid reflux occurs when acidic contents of the stomach leak back into the esophagus and cause irritation. It's estimated that 25 to 35% of the U.S. population has GERD. That's a lot of people. An analysis of several studies published, in the early 2000s concluded that GERD is much more prevalent in people who are obese. So obesity is our risk factor for GERD. The most common GERD symptoms are things like heartburn, regurgitation, cough, and trouble swallowing. And the causative factors for GERD that may be separate from or entwined with obesity include these risk factors. So some of them are just, they're overlapping with obesity in most people. The sphincter that separates the stomach internal contents from the esophagus often does not function properly in this disease, and acidic gastric contents will seep upward, and that is sometimes the peristaltic contractions of the esophagus can be sluggish and compromise the clearance of the acidic contents, and that can be a problem. In addition, having an unbalanced high-fat diet can be an issue, and some people with GERD are sensitive to particular foods like chocolate, garlic, spicy foods, fried foods, tomato-based foods, which it will worsen the symptoms. And drinks containing alcohol and caffeine can worsen GERD. And GERD is diagnosed most often by history of frequency of reoccurring symptoms. That's usually how a person gets a diagnosis of GERD. A more proper diagnosis would be if they actually used a device and lowered it into the esophagus and measured the acidity and the contents of that esophageal area while during a person's activities. But I mean, we just don't really do that much to diagnose GERD. They usually just ask about a person's symptoms and they'll diagnose a person with GERD. So about 50% of people with GERD have inflamed tissues in the esophagus. So that would be like physical evidence of the GERD damage. So the first approach to the GERD treatment is with dietary and lifestyle modifications. They're going to change their diet. They're going to not lay down right after eating and things like that. If they're obese or overweight, they may need to lose some weight to see if that will help. They're supposed to avoid foods that worsen their symptoms, eat smaller meals, stop smoking if they smoke, and being upright for about 3 hours is a good rule of thumb after a meal, and that can really help someone with GERD. People with GERD may not take in nutrients they need because of the pain and discomfort associated with eating. So there's like things that they may avoid that they could really need in their diet because it causes them pain. And so they can have really unbalanced diets sometimes if they have severe heartburn and GERD symptoms. It can become a real vicious cycle that compromises their health. And some evidence from science indicates that medications used to treat GERD may accentuate certain vitamin deficiencies, namely zinc and magnesium. So sometimes when we try to fix this problem with medicines, we can cause some deficiencies. But the medicines are also kind of miracles for a lot of people, and they really need them to avoid limiting their diet in a major way that would cause them harm. So when treatments that are medications and lifestyle choices and these other treatments we've mentioned don't work, surgery is an option. The most common surgery involves reinforcing the sphincter that serves as a barrier between the stomach and the esophagus. Honestly, I see less people getting surgery. I mean, at least personally, I see less people getting surgery for this than I used to. It seems like we'd have some pretty good drugs these days for GERD, and a lot of people are becoming more educated, so that helps. But GERD is a really big problem. It makes a lot of people very uncomfortable. You can use antacids like Tums, but for most people that have GERD and have a consistent problem with it, they'll end up taking something like a Prilosec, one of those medications that actually lowers the acid in the stomach. All right, next we're going to talk about irritable bowel syndrome. So irritable bowel syndrome, often called IBS, is characterized by muscle spasms in the colon that result in abdominal pain, bloating, constipation, and or diarrhea. Now, it's important to note that people with IBS often get diagnosed with something like this: IBS-C, which is IBS with constipation, or IBS-D, which is IBS diarrhea. They primarily have diarrhea. The ones that are IBS-C primarily have constipation. And then there's the mixed type where they have both, alternating one and then the other, one and then the other. And IBS actually produces no permanent structural damage to the large intestine, and it often is considered a little less severe or serious in terms of risk than diseases like Crohn's disease or inflammatory bowel disease, which do destroy the intestine lining. It's estimated that 1 in 5 Americans display symptoms of IBS. The disorder is more prevalent in women than men, and 2 primary factors that contribute to IBS are an unbalanced diet and stress. So, many people will develop these type of symptoms: bloating, abdominal pain, constipation, diarrhea. If they are sent to a doctor or specialist in gastrointestinal problems, they often have a whole workup to see what's wrong. They get tested for things like celiac disease, for colon cancer, for GERD, even if they have upper GI symptoms, because they're having symptoms. They'll get worked up for all kinds of things. And when nothing is found, there's nothing wrong with the mucosa in the GI tract, especially that lower part, which is the part we're talking about for the most part with irritable bowel syndrome, they'll often be diagnosed with this functional disease, irritable bowel syndrome. Now, even though it does not cause damage to the mucosa or to the large intestine the way Crohn's disease and irritable bowel syndrome do, it really decreases people's quality of life. And they will have a lot of problems sometimes, and it'll limit where they go and what they can do. And so we definitely want to take this disease seriously. Large meals and foods high in fat, added sugars, and those that contain wheat, rye, barley, peppermint, and chocolate can intensify or bring about symptoms in IBS. So people may try to limit those to try to get their symptoms under control. Additional issues could be beverages containing caffeine or alcohol could worsen IBS. Stress and depression compound the severity and frequency of IBS symptoms. So stress is just huge with IBS. And when people go through a stressful period, they often have an exacerbation of their symptoms. So just like GERD, the first treatment approach to IBS is going to be diet and lifestyle modifications. People with IBS are often told to keep a daily food journal to try to figure out what makes their symptoms worse and what makes their symptoms better. Other recommendations might be to eat slower, to eat more fiber, to drink more water or fluids, and to exercise. There are also some medications, relatively new, and some of them are to treat symptoms, and some of them are for diarrhea. Some of them are for constipation. There's also antidepressants and drugs that will relax the colon, and any of those could be prescribed for someone with IBS. They're treated individually by their healthcare providers. All right, so that's irritable bowel syndrome. Let's talk about celiac disease, just to review, because we talked about celiac disease when we were talking about the gluten-free diet, but 0.5% to 1% of Americans have celiac disease, and it is an autoimmune disease where the body is attacking a part of itself. Bread, including wheat, rye, and barley, contain gluten and should be avoided. Corn, millet, and buckwheat and oats do not contain gluten. Some people with celiac may react to products that contain oats, but that's usually some kind of a cross-contamination problem. It's not they actually can't eat oats, it's that the oats are contaminated with something else, some gluten-containing something. And so that's celiac disease. Okay, now let's talk about food allergies. So food allergies are affecting about 12 million Americans that we know of, but there's probably many more people that have food allergies that are just not diagnosed. In a food allergy situation, the immune system mistakenly attacks foods as if they are dangerous. And the foods aren't dangerous, but the body attacks anyway. And you can have very serious allergic reactions to foods. You can have very mild ones. Sometimes they can be deadly. Symptoms include a tingling mouth, swelling tongue, or throat, and this is one of the ways it can kill you because you can't breathe. Difficulty breathing, hives, stomach cramps, diarrhea, vomiting, drop in blood pressure. That one can also cause death. Loss of consciousness, and then death is the most severe symptom of a food allergy. Now, of course, you're not going to have all of these. You may have some if there's a food allergy problem. And you could only have one even. You could also just have itching. That can happen too. And maybe you wouldn't get the hives, or they would look just like red skin as if it's one big hive. That sometimes happens. So food allergies are a very serious problem. They are increasingly a problem. One of the reasons we think that they may be increasing is something called the hygiene theory, because the cleaner the environment is, the more likely children are to have food allergies. So if you are in a society where there's not a lot of farming, there's not a lot of exposure to dirt and whatnot, you actually have a higher risk of food allergies. If you live on a farm, you're less likely to have food allergies. So that is an interesting theory. And then in places where children grow up on farms and theoretically have a dirtier environment, there is less food allergies. So one of the reasons we think that might be happening is that the body doesn't have any parasites to fight off in that clean environment. And because there's no parasites to fight off, somehow the body develops more propensity to attack foods, or attack anything, but attack foods in this case. Attack anything non-dangerous, in this case foods. So when that happens, you're more likely to get food allergies, and they are pretty serious. You'll have kids and adults that have to carry an EpiPen and Benadryl. And one of the ways we treat this is with epinephrine, which prevents the anaphylactic shock that causes the drop in blood pressure that's often responsible for the deaths. And then also can, when the throat starts to close up, it can open up the airway. So the epinephrine can help prevent and reverse to some degree a food allergy reaction. Also, antihistamines like Benadryl are used, but really they need to have that epinephrine in case they have the really severe type of reaction. All right. So the most allergenic foods are peanuts, tree nuts, eggs, milk, fish, shellfish, wheat, and soy. And this list is responsible for the vast majority of food allergy problems. And we require labeling of the most allergenic foods on our food labels to try to help people with food allergies manage their condition. And that really is relatively new compared to some regulations about food. There is evidence that it has really helped, because prior to that, people with food allergies would have to look at the ingredients list and try to figure out how careful they needed to be about eating a certain food. There was also no information about cross-contamination. Information about cross-contamination might include something like processed in a facility that also processes peanuts. That's really important information for someone with a peanut allergy to know, because there could be cross-contamination of those peanuts into the food that they are eating, and they would want to know that that's a possibility. All right, so other diseases that we just want to mention here at the end of this lecture, we have oral disease. Now, oral disease can include things like our teeth and our gums, and this really, really impacts our ability to eat well, okay? If you do not have adequate dentition, which is your teeth, and your gums are diseased and your teeth are loose, you may have difficulty eating at all. And certainly eating certain types of foods would be very difficult for you. So good dental health is important to nutrition. We talked before when we studied the minerals about fluoride and how important it is to do some kind of supplementation of fluoride in environments that don't have much fluoride in the environment, in the water, or in the foods because it's not in the environment very much, because it really helps prevent dental caries. Now, oral health refers not only to those healthy teeth, but also the gums, because those gums support the teeth. You also have ligaments, nerves, jawbone, chewing muscles, and salivary glands, and all of those need to be healthy in order to have a good nutritional status or optimum nutritional status. Some of the enemies to all this are soft drinks, sports drinks, candies, desserts, fruit juices, sources of fermentable sugars. This is what these basically are. And they are metabolized by bacteria in a process known as fermentation. So glucose, fructose, and maltose are 3 examples of these. So the bacteria that inhibit, that are like in the mouth, so they inhabit the mouth, they can metabolize these fermentable sugars and starches that are found also in refined grains, and they basically turn them into acid that can erode the tooth enamel and the deeper bone tissues if it gets bad enough. And that acid creates holes or cavities in the teeth. They're sometimes called dental caries, and these can be extremely painful, but they also cause damage. So the gums can be damaged by the bacteria producing the acids also, and that can lead to a disease called gingivitis, which is gum disease. It's characterized by inflamed and bleeding gums, and they'll also recede. The saliva can actually be a natural deterrent from this process, like a natural mouthwash to neutralize the acids that are building up there so that the teeth can't be damaged. But so if you have a dry mouth, you're going to be more likely to have oral problems like oral disease, gum disease, tooth decay. According to public health sources, about 23% of U.S. children have cavities by the age of 4, and that's with all the interventions we're doing, like the fluoride, the education, the going to the dentist. Lots of people are going to the dentist. Some are not, but some do. And by 2nd grade, 1/2 of all children in the United States has at least one cavity. So cavities are an epidemic health problem in the U.S. and all over the world, and are associated with poor diet, but other contributors to poor dental hygiene are inaccessibility to regular oral care, like we just talked about. Some people don't get to go to the dentist at all. And the American Academy of Pediatrics reports frequent consumption of fast-release and carbohydrates is a major problem and increases dental caries. So we really want to discourage those sugary soft drinks and other sugary drinks, and we want to make sure people are brushing their teeth and cleaning their teeth properly to decrease decay formation. So oral disease, and let me also mention, because this sometimes doesn't get mentioned, that it really should be mentioned. Your oral health is connected to your cardiovascular health. If you have bad dentition, you have lots and lots of dental caries, bad gingivitis. These things actually contribute to inflammation in your body and contribute to heart disease. And we don't even know exactly what the tipping point is, or if there's a tipping point at which this is going to make a huge difference and when it's not. Like, we don't have all that figured out. But we do know that this inflammation is dangerous, and it's a contributing cause to heart disease. Also, something to keep in mind, it also contributes to preterm birth. So if there is a pregnant woman who has bad dentition, oral cavities, oral disease, gingivitis, that pregnant woman is going to be more at risk for a preterm delivery, and then that baby that is born will have increased risk of all the things that happen when you are born too soon. Death is one of them, but then there's all kinds of other things that even if you survive, you're higher risk for because you were a preterm baby. And so we want to take care of our oral health, not just for our oral health, not just for our nutrition, but also because it decreases our risk of heart disease and it improves the ability of women to carry babies to term and give birth to healthier babies. All right, important to remember. I have definitely had patients that were in the intensive care unit critically ill because of their teeth. So it can have a huge impact on one's mouth. They get infections and abscesses and end up septic and nearly dead, and dead sometimes, because of their poor dental condition. Okay, colon health. So we've talked about fiber and how important it is. I don't know if I need to belabor this point any further, but fiber is really, really important. Fiber actively supports digestion and optimizes colon health. There's good evidence supporting that insoluble fiber prevents the irritating problem of constipation and the development of diverticulosis and diverticulitis. So diverticulosis is a benign condition characterized by outpouches of the colon. So little pouches form. It's related to chronic constipation. Diverticulitis occurs when the outpatches and the lining of the colon become inflamed. Interestingly, the diverticulitis did not make its medical debut until the early 1900s. Like, we didn't have any before that. And in 1971, it was defined as a deficiency of whole grain fiber. So you could even consider this a deficiency disease. Isn't that interesting? According to the National Digestive Diseases Information Clearinghouse, about 10% of Americans over 40 have diverticulosis. So it's very common in middle-aged and older, and about 50% of people age 60 have this disorder, or over age 60. 10 to 25% of people with diverticulosis will all go on to develop diverticulitis. So you can see it's not everybody who gets the diverticulitis, just 10 to 25% of the people with diverticulosis. Symptoms of diverticulitis include lower abdominal pain, nausea, and alternating between constipation and diarrhea. So the chances of developing diverticulosis can be reduced with fiber intake because of the breakdown products of the fiber and what those do for the colon. The bacterial breakdown of fiber in the large intestine releases the short-chain fatty acids. We talked about that when we talked about lipid metabolism, and these molecules have been found to nourish colonic cells, inhibit colonic inflammation, and stimulate the immune system, which is a protection of the colon from other harmful substances, because the colon gets exposed to a lot of stuff. Additionally, those bacterial indigestible fiber, mostly insoluble, increases the stool bulk. So the stool actually gets bigger because of this indigestible fiber. The bacteria can't digest it. And softness increases the transit time of the large intestine and facilitates feces elimination. So this prevents constipation. It makes the stool not get as hard, and it's not as difficult to pass. It's easier to pass. One phenomena of consuming foods high in fiber is that it increases gas, since the byproduct of the bacterial digestion of the fiber is gas. So, and it's one of the side effects, basically, of having this very healthy fiber in your system. And if you increase the fiber slowly, you can adjust to it a little bit better. So some studies have linked dietary fiber intake, like a high fiber intake, and decreased risk of colon cancer, but we're not really sure. The jury is still out. Some studies have not found that the dietary fiber intake is associated with a reduction in colon cancer. There is evidence that specific fiber types, like inulin, may protect against colon cancer, but more studies are needed to conclusively determine how certain fiber types and what doses of those types can help prevent that colon cancer. Now, colon cancer is increasingly common. We don't really know why yet, but people younger and younger are getting colon cancer. And we used to say to screen people over like 50, and then it went down to 45, but now I think it might be even lower than that. But that's because we keep seeing it at younger ages. The current cancer recommendation for screening is to do a colonoscopy in middle age, and then to do it again every 10 years if they have polyps or other problems found on the colonoscopy, which is basically a tube that looks at the mucosa of the large intestine to see if it sees any polyps, which could turn into cancer eventually, or certainly any cancer. Then that is the best. That is the best way, a surgical way, but the best way to screen for colon cancer. There are some ways to screen that are coming around that look at the stool, look at what's in the stool, look at the genetic makeup of some of that material, and maybe can diagnose colon cancer without a colonoscopy, because colonoscopy is really not an uncomfortable procedure for the most part, because people are, they are under sedation. They don't know what's happening during the procedure. But the prep is difficult because they have to basically clean out the colon, and so they have diarrhea for like a whole day to get ready for the procedure. So, that can be rough on people, but it's a very valuable tool, and since colon cancer is common, it has saved many lives to do colonoscopies. And colonoscopies are also used for, ulcerative colitis, Crohn's disease, to look at the mucosa, and those diseases also, if you got diagnosed with irritable bowel syndrome, you may have had a colonoscopy to see if you had Crohn's or ulcerative colitis. So anyway, that is an important procedure about looking at colon health for middle age and older. There are people that will definitely refuse to have one and not follow that screening guideline, and they may be able to do one of these newer tests, or they may be able to do a test for occult blood to see if there's any blood in their stool, and that can give a clue about how important it is for them to do a colonoscopy. If they're positive for occult blood that can't be seen, then their healthcare provider can encourage them, please get a colonoscopy or one of these other tests. I know you don't want to have it, but you have a reason now that we have found that there's blood in your stool. Then we have osteoporosis. Now, we talked about osteoporosis during our mineral lecture because we talked about calcium and some other minerals that can help decrease the risk of osteoporosis. So I'm not going to spend a whole lot of time on that. I'm just going to go over some risk factors that we didn't discuss before. I think we might have discussed physical activity is a way to decrease the risk of osteoporosis. Now, it needs to be weight-bearing physical activity. If you're swimming, then that's not a very weight-bearing exercise, and it won't help you as much as something like aerobic exercise, biking, things that puts weight on the bones, even the body's own weight on the bones. But when you get into the water, you're basically not putting weight on the bones anymore. So it doesn't help as much with osteoporosis. If you're underweight, then, especially if you stay underweight a long time, you may have a much greater risk for osteoporosis. That underweight status doesn't put as much weight on your bones and doesn't allow you to build bones as well. Anorexia nervosa, thereby, is a risk factor for osteoporosis. Smoking and alcohol and caffeine are all related to osteoporosis. Using any of those can increase your risk. Now, most of us do consume at least some caffeine. Hopefully, people are smoking less and not smoking at all, never starting to smoke. Alcohol consumption, again, we're finding people are drinking too much alcohol, and so we're trying to get them to stop drinking as much. But that is also a risk factor for osteoporosis. Remember that postmenopausal women are at high risk for osteoporosis. That's related to entering menopause, their hormone shifts in middle age due to no longer menstruating. Okay. So definitely nutritional factors can contribute to one's osteoporosis risk. You want to make sure that you're getting the proper minerals, especially calcium and vitamin D, to make sure that you can build and maintain your bones. All right, osteoporosis prevention. Although the symptoms of osteoporosis do not occur until old age, osteoporosis is referred to as a childhood disease with old age consequences. Why? Because preventing osteoporosis in old age begins with building strong bones while you are growing. Remember that more bone mass a person has to start with, the greater the loss a person can withstand without developing osteopenia or osteoporosis. So if you start out with strong bones and you build those when you're young, in your childhood and in your adolescence and on into your early adult years, then when you do lose bone, say you're a menopausal woman, when you do lose bone, you'll have more to lose. Growing and maintaining healthy bones requires good nutrition, adequate intake of minerals and vitamins that are involved in maintaining good bone health. And remember that weight-bearing exercise. Prevention extends throughout a person's life, and people with one or more risk factors for osteoporosis should have their BMD measured. The National Osteoporosis Foundation recommends the following groups of people to get their BMD measured. Okay, these are the people that need to be screened. Okay, we talked about colon screening before. These are the people that need to be screened for osteoporosis. Women who are 65 or older, they've gone through menopause, they're past it, and we want to see if how much bone they have lost. Men who are 70 or older, so they not quite as young, but they can and do get osteoporosis. Women and men who break a bone after age 50. So if you go break a bone and you're 60, they should be screening you for osteoporosis because we want to know why that bone broke. Was it higher risk to break? Because there's treatments for osteoporosis. Women going through menopause with other risk factors. So if a woman has a history of anorexia nervosa, if a woman is on a medication that causes bone loss, many other factors. If they have poor diet, then they may need to be screened. Men 50 to 69 years of age with risk factors should be screened also. So men with those risk factors, go ahead and get screened. So osteoporosis, and you can kind of tell if someone is at risk for osteoporosis based on a lot of their health history. You can just kind of look at somebody's chart or health history and kind of go, let's see, what's their weight been? What medications do they take? How old are they? Have they gone through menopause? Things like that can really tell you. All right, so now we're going to go over some chronic diseases real quick. I know we're getting tired. Chronic diseases that we want to talk about as we move forward. We got heart disease. We've got unmodifiable risk factors. And what an unmodifiable risk factor is it's a risk factor you can't change. Risk factors for heart disease that are not modifiable are age. There's an increased risk for men at age 45 and for women at age 55, okay, and older, of course. Sex. Men are at higher risk than women, though the risk for women steeply rises after menopause. So after menopause, women become more like men in their risk for heart disease. Family history. The more family members who have had heart disease, the greater the risk. So if you've got a family full of people who had early heart disease, then that is a risk, a significant risk. If they were all, 95 years old, then, by 95 years old, a lot of people are going to have heart disease. So it might be a little bit less of a risk. But if there's a whole lot of them, maybe you should still look at that. Modifiable risk factors are ones you can change. Cigarette smoking, because nicotine constricts the blood vessels and carbon monoxide damages the inner lining of blood vessels, which increases the risk of atherosclerosis. Obesity. Excess weight worsens other risk factors. Diabetes. This condition is associated with an increased risk of heart disease. Period. It's very important. Diabetes increases risk of heart disease. Both types have certain risk factors in common, including obesity and high blood pressure. So diabetes type 1 and 2 can have obesity and high blood pressure. associated with physical inactivity. Lack of exercise is associated with heart disease. Again, very, very important. Exclamation marks. Very, very important. Cholesterol levels. High levels of blood cholesterol can increase the risk. High levels of low-density lipoprotein, LDL, the bad cholesterol, underline bad right there, bad cholesterol, is a common contributing factor. However, a low level of high-density lipoprotein, or good cholesterol, can also promote atherosclerosis and therefore heart disease. Back to the diabetes, where it says both types have certain risk factors in common, they're talking about how obesity, high blood pressure, and diabetes occur in the same people a lot, if that was unclear. All right, hypertension, unmodifiable risk factors. Those are age. After age 55, the risk of developing high blood pressure is 90%. Okay? That's a high risk. Race. African Americans are more likely to develop hypertension that manifests at a younger age, and they also have higher blood pressure readings. So this is very common in African Americans. We want to help them manage it because we don't want them to have higher rates of heart disease related to their hypertension and other diseases related to their hypertension as others, and currently they do. So we want to make sure that we help them with that. Family history. There is a strong genetic component to high blood pressure, and an individual's risk goes up along with the number of family members who have hypertension. So again, if you got a family full of women who've had high blood pressure, you want to be watching that. Make sure that when you develop it, if you do, that it is managed. Modifiable risk factors include weight. Roughly 60% of people with hypertension are obese. Sodium consumption. We're all eating too much salt. We've talked about that, and increases our blood pressure. Alcohol, drinking more than 2 drinks per day for men or 1 drink for a woman a day can increase the likelihood of hypertension. Diet, in addition to salt and alcohol consumption, other dietary factors increase the chances of developing hypertension. All right, cancer. We haven't talked about cancer so much in this class, only when we've been talking about the colon and whatnot. But modifiable cancer risk factors. Age. Most cancers occur in people over the age of 65. People of all ages, including children, can get cancer, but most cancers occur in older people. Family history. Certain types of cancer have genetic links. However, environmental factors may play a part. Tobacco is a that is backwards. I am so sorry. The non-modifiable risk factors are age and family history. The modifiable risk factors are tobacco, alcohol, obesity, cooking techniques, red meat. Let's go back to the cooking techniques because that one needs to be explained a little bit. Grilling, smoking, and preparing meat at high temperature forms carcinogens. So if you're like really, really cooking that meat, getting it very, very done, that actually increases the carcinogens in it. Cured meat. According to recent studies, there is a mild risk of pancreatic cancer with the consumption of cured meat like sausage, pepperoni, bacon, ham, smoked turkey, salami, and hot dogs. Physical inactivity is a risk factor for colon, breast, and other cancers. Exposure to chemicals, especially people that have jobs where they're exposed to chemicals on a regular basis and they do the same job a long time often, then they are at risk. Like construction workers and painters have an increased risk of cancer. Viruses and bacteria can contribute to our cancer risk. Certain viruses or bacteria may increase the risk of developing cancer. And this is a good example. The human papillomavirus, which is a sexually transmitted virus that is very common, are the primary causes of cervical cancer. So today we're trying to vaccinate women for the HPV or human papillomavirus so that we will have lower rates of cervical cancer in women, because this is a really common virus that gets passed back and forth among people. And it is a sexually transmitted disease, but it's so easy to pick up that it's just super hard to avoid. People don't even know they have it. There is no test for men, And for women, we can check the cervix to see if they've been exposed to HPV. But, once you have it, your body usually clears it, but it can put you at risk for cervical cancer. So we want to protect people from these cancers. We also give the human papillomavirus vaccine to men too today. So we're trying to prevent cancer by doing that. All right, diabetes. Let's talk about diabetes real quick. Type 1 diabetes is the one that people don't make insulin. It's an autoimmune disease. Type 2, related to obesity and overweight, that increases the risk of diabetes. And gestational diabetes is the kind of diabetes that people get when they are pregnant, when pregnant women can get. And they only have it when they're pregnant usually, and it'll go away after the baby is born, although sometimes it can linger. Then there's prediabetes. And as the term infers, prediabetes is a metabolic condition in which people have a moderately high glucose level but have not met the criteria for diabetes. And they need to be treating themselves already, similarly to a diabetic. And sometimes when they do that, they can prevent the progression to diabetes or can slow it down. And so that will help them to avoid the long-term risk of diabetes. And what are those long-term risks? As a result of chronically high glucose concentrations in the blood, accompanied by other metabolic abnormalities such as high blood lipid levels, people with diabetes are between 2 and 4 times more likely to die from cardiovascular disease. So that's pretty big. Diabetes is the number one cause of new cases of blindness, lower limb amputations, and kidney failure. And I can tell you, as a former nephrology, that means kidney, nurse, I had so many patients who had lower limb amputations and blindness. And almost all of my patients had diabetes. So it is a huge risk factor for kidney disease, okay? These lower limb amputations usually happen because the people have diabetes often, or they have peripheral vascular disease, or they have both, and they get a cut or an injury to their foot or their leg, and they develop a sore that then results in an infection that nobody can fix because there's not good blood flow to the area, and they end up having to have the foot or the leg amputated. So we had a limb-saving team that was a group of vascular surgeons that would try to get do bypasses and things with the leg to try to save the leg, to try to get enough blood flow down there to heal the wound. But, it wasn't always possible. It didn't always work. And so they would still need an amputation. So many people with diabetes develop peripheral neuropathy, which is when the nerves don't work well in the periphery, meaning the foot. And that's one of the ways that they develop these sores, because they don't feel their lower extremities as well. So if they hurt their foot, they may not even know it. I had a patient one time who was walking around with a piece of glass in her foot, on the bottom of her foot, and she had diabetes and neuropathy and she didn't even know it. And she had a wound from that, and it was just really sad. She didn't know. Most people would have felt it, but she could not feel it. More recently, scientific evidence suggests that people with diabetes are also at increased risk for Alzheimer's disease. So when we talk about trying to prevent Alzheimer's disease, we want to get prediabetes dealt with to prevent diabetes. We want to get diabetes well managed. We want to prevent as much of these long-term side effects of having those diseases as we can. So a normal blood glucose is 70 to 130. We want it to be in the normal range as much as possible. Then this is the normal range before a meal, 70 to 130. Okay. So next we're going to talk about metabolic syndrome. This is a syndrome that's associated with heart disease, associated with some of the other chronic diseases we've been discussing. We've got visceral obesity, which is obesity around the belly, insulin resistance, where the body is not responding to the insulin. Low HDL cholesterol, so the good cholesterol is low. Hypertension, which is high blood pressure, and high triglycerides, which is one of the things we measure when we measure blood lipids, and that is, together, metabolic syndrome. And so metabolic syndrome is a clue that you may be on your way to developing these chronic long-term side effects. And so you want to deal with the metabolic syndrome and try to keep that at bay. And so metabolic syndrome is like a warning sign. Okay, let's talk about overnutrition, undernutrition, and malnutrition. So undernutrition is bad for you. Overnutrition is bad for you. Malnutrition is also bad for you. It doesn't matter whether you're eating too much or too little. It is not okay. It's poor health. It's going to be problems down the road. So everyone needs to know that. Overnutrition is when you're eating way too much. Undernutrition is when you're not eating enough. Malnutrition is when you're not getting the nutrients you need. Malnutrition refers to one not receiving proper nutrition, quote unquote, and does not distinguish between the consequences of too many nutrients or a lack of nutrients, both of which impair overall health. So there's your official definition. Undernutrition is characterized by a lack of nutrients and sufficient energy supply, whereas overnutrition is characterized by excessive nutrient and energy intake. Overnutrition can result in obesity, okay, and growing global health threat this obesity is because it's becoming more and more and more and more common. So obesity is defined as a metabolic disorder and leads to an overaccumulation of fat tissue. And some of it may be that visceral fat tissue that we just said was part of metabolic syndrome and is a big warning sign of problems. Okay, so although in the United States undernutrition is less common than obesity and overnutrition, it does affect a subpopulation, including the elderly and those with certain diseases and those living in poverty sometimes. Many people who live with diseases either have no appetite or are not able to digest food properly, and this can lead to undernutrition. Some medical problems of malnutrition include cancer, inflammatory bowel syndrome. Irritable bowel syndrome, you should have normal ability to absorb food, but inflammatory bowel syndrome, you may not. AIDS, Alzheimer's disease, and illnesses or conditions that cause chronic pain, psychiatric illnesses, and anorexia nervosa. These are common problems that people may have that cause them to not be able to take in food or sometimes, take in too much food, but they're causing a malnutrition problem. They're not getting proper nutrition. Overnutrition is an epidemic in the U.S. and is known to be a risk factor for many diseases, including type 2 diabetes and cardiovascular disease and inflammatory diseases like rheumatoid arthritis and cancer. All right, so risk factors for being underweight, definitely related to osteoporosis. Anorexia nervosa is a psychiatric condition that can cause people to become very, very underweight and even die. It has a very high mortality rate compared to other psychiatric diseases, as the highest one of all. So it's important to make sure people get help when they have anorexia nervosa. And once they've recovered from anorexia nervosa, assuming they do, they need to be screened for osteoporosis and other problems as they age that may have come about because of the risks that their body was exposed to due to anorexia. All right, bulimia is a psychiatric disease that has health consequences also. Bulimia is characterized by episodes of eating large amounts of food and then purging that food either by vomiting or with use of laxatives. Unlike people with anorexia, those with bulimia often have a normal weight, making the disorder more difficult to detect and diagnose. It's easier to hide because their body doesn't look different to other people. But it is a serious illness. There are some signs, including GERD, severe erosion of the tooth enamel. So sometimes a dentist will pick up on this. Dehydration, electrolyte imbalances, lacerations in the mouth, and peptic ulcer disease. And they can have repeated damage to the esophagus that really puts them at risk for esophageal cancer in later life. All right. And then there's binge eating disorder, where people are binge eating. They'll eat large amounts at one time. And there's orthorexia. That's spelled ORTHOREXIA. So orthorexia nervosa. That is a disease where people are basically trying so hard to be healthy, they become unhealthy. And that's a problem today also. It's a kind of a newer problem, at least its recognition is newer. And it's related to OCD. Warning signs of orthorexia nervosa are compulsive checking ingredients and lists like nutrition labels, an increased concern about health and ingredients, cutting out an increasing number of food groups, such as all sugars, all carbohydrates, all dairy, all animal products, and an inability to eat anything but a narrow group of foods that are deemed healthy or pure, unusual interest in health of what a person is eating, spending hours a day thinking about what food might be served at upcoming events, showing high levels of distress when safe or healthy food is not available, obsessive following of food and healthy lifestyle blogs on social media, and body image concerns may or may not be present. Sometimes they're not worried about their body image, sometimes they are. But this is a problem. They wouldn't have all of these signs necessarily, but these are just some signs. All right. So, eating disorders can be treated. Many people recover very well from them, but they can be very, very serious and cause disability or death if left untreated or if they are very severe. Okay, so that's all of our lecture today. If you have any questions, please let me know. Thank you for listening.